Hi, and welcome to Let's Talk episode 17. Today we are talking about the awareness of road traffic accidents. To discuss more about this, we will be introducing Dr. Sridhar Maram, Head of Emergency Medicine and Citizen Specialty Hospital, Nalanda. So, firstly, I would like to ask how to respond to an accident.
Road traffic accident, especially in India, is a major concern. It is a leading cause of more hospitalization and death and morbidity, also quality of life. 90% of road traffic accidents are due to over speeding and rash driving. Uh, Better is the prevention by following the traffic rules and need response from the community towards injured patients. If any road traffic accident happen, the way the community has to respond as to identify and going for the help and mobilize to the nearest hospital is prime important. That can be like life saving and decreasing the improving the quality of life after the trauma. So how to respond? Respond in terms of like you need to see your own safety first, and at the same time the injured person's safety also. If the place or if the accident scene is not safe, try to mobilize the injured person with proper technique. We should not traumatize the spine. Move the patient with limited mobility of the spine and keep in the safe area and do the first aid things. Before doing the first aid, call for help. Assess the injury, call for help, like calling 108 or any nearby medical emergencies, and do the first aids. That's how response is prime important when leading any severely injured patients.
So, secondly, how to retrieve the patient from the scene.
A lot of accidents, severe accidents we can see nowadays, like a crash, like 2 or 3 car crash, and people will trap in the car. So, how to retrieve the patient, how to mobilize from those car crash. So we need to assess. We need to see like a few patients, even though like a major crash, they won't have much injuries. We can retrieve the patient directly. And in few, if the person is not responding properly, and we need to move out of the vehicle and do the resuscitation. In few patients, there is a high chance of internal injuries that might be through and through or puncture wounds. And if the person is conscious, we need to reassure the patient and we make sure that is taking proper breathing. And then we need to wait for the help of the medical team. Why? Because if you retrieve in a wrong way, if you mobilize the patient from the crash car, it will harm much more damage. It will cause much more damage to those patients. So you need to assess and you need to identify whom you have to retrieve, whom you should not.
How to assess and what are the dangerous symptoms to be observed from the seriousness of the patient.
Yes, after retrieving the patient from the scene, we need to assess in terms of whether the patient is taking oxygen in or not, whether the injured person is taking breathing normally or not, and whether the injured person is is conscious and oriented. If any foreign body, any like food particle or any blood in the mouth, if you are able to clear it out, you can clear the mouth. And at the center we need to see whether there is a proper chest rise, like taking breath or not, we need to assess. And at the center last is we need, as early as possible, we need to check the pulse. If the severe injured person is not responding, if no pulse, we need to do CPR and do the resuscitation. And if the injured patient is conscious and oriented, we need to identify some dangerous signs which may have severe internal injuries. Like if the injured person has any time loss of consciousness or any vomiting or any abnormal movements or any altered sensation, these are the very dangerous signs, and he needs evaluation in nearby hospital.
Sir, if the person is not moving and the appearance feeling like dead in trauma, can we do the CPR on those patients?
Definitely, after assessment, if the injured person is not responding, we need to check for the pulse. If no pulse, we definitely start the CPR and do the resuscitation until get help arrive. We should not distract the with injuries. If you find like any fractures or any bleeding somewhere, we should not distract with those injuries. If there is no pulse, we should start the CPR, and rest of the help who are nearby, they will do the rest of the things. But Yes, if the patient doesn't have any pulse, if the patient is not responding better, we need to start the CPR.
So, fifthly, can we offer food or water to the injured person?
No, in most of the instance, we used to offer after trauma, we used to offer water or any food. It should not be like, especially in unconscious patient and a drowsy patient, we should not give anything by mouth. Why? Because whatever you give through the mouth, it will enter into the lungs. It will become more problematic rather than not giving the food. And in even though if some injured patient, if they are like conscious, well oriented, but still better to avoid giving oral. Why? Because like on evaluation, if you find any like internal bleeding or anything, we need to do some procedures that may affect the procedure. So better not to give anything orally. We should not give ideally.
Sir, how to stop bleeding? What are the measures would we take?
So, like after proper assessing, if you feel there is no major concern about life, then if you find any bleeding point or bleeding somewhere on the body, but directly put the pressure over the bleeding point. If you are able to stop the bleeding, fine. If you are not able to, you can use the tourniquet. Why? Because like if you do not tourniquet off, if you do not stop the bleeding, it may worse. Like bleeding will be continued. The patient might have many problems. Better like put direct pressure or like use any ligature with available material like any cloth or anything, like tie it around the wounded area so that bleeding will be stopped. It will be much helpful in first aid, especially in severely injured patients. And at the same time, we need to see like a front and all parts of the body. Few might miss on the back of the side. So we need to see back also, and if any bleeding point is there, just apply the pressure and mobilize the patient to nearest hospital.
Sir, how to handle fractures in road accident scenarios?
In severely injured patients, we might across severe fractures that like even bone will be exposed. In those patients and in fractures, in few fractures also, whatever the resources available, use as a splint, like any wooden sticks or like any cardboard also fine. Apply it and try to immobilize above joint and below joint of the fracture so that it will decrease further injury to the vascular, especially nerves and vascular damage, and at the same time the pain also will be under control. And do that splinting and then mobilize to the hospital. That will be more helpful in severely traumatized patients.
So, should all the patients need hospitalization?
Yes, basic evaluation is needed for all like road traffic accident, especially in high velocity injuries. Even though the like injured patient is looking fine, but his companion, like if has any major fractures, he need to be evaluated. Why? Because there is a high chance of missing of internal injury. I'm talking about like high velocity injuries. Definitely, the patient need basic evaluation.
So, what is your opinion to bring the awareness on this road traffic accident?
Yes, like road traffic accident, as I said, prevention is prime important by following the traffic rules and avoiding overspeed. Why? Because as I said, 90% of the accident are due to overspeed and rash driving. So community should be aware, like what are the first aid things they have to do, like if they come across any severely injured patients. As I said, scene safety is the prime important. Like if any accident happens on the center of the road, make sure it won't affect the person who is helping, and at the same time the severely injured person also. So after seeing the scene safe, assess the patient and see the injuries and go for the help. Either you need to call 108 or any other toll-free number for the medical help. After that, like if you know basic things regarding the first aid of any injured patients, you need to do that basic things in terms of like seeing whether the patient is conscious and well oriented or not, and whether he's taking breathing properly or not, or any bleeding point over the body or any severe fractures. So we need to assess like this, and we need to do some basic steps. Like if you find any object in the mouth or any blood particles or any other particles, you can try to remove that, and after that you can see the whether the patient is conscious or not. If the person is not conscious, and check for the pulse. If no pulse, even though there is a bleeding, much bleeding over the body or any major fractures, if there is no pulse, you need to start CPR. So you need to resuscitate the patient and till medical help arrives. If the patient is conscious and if it is difficult to retrieve or mobilize from the crash vehicle, we need to assess properly whether we should retrieve the patient or we can keep the patient there and wait for the medical help. We need to decide. Why? Because like severely injured patient, if you mobilize or like if you move from the crash vehicle, it will harm more. And at the same time, whenever you are dealing any trauma patients, make sure that the spine should be in single moves, that the spine should be in a limited movements. Like the spine should be kept in a single way, or like should not move much, should not manipulate. Why? Because even though if you can't find an external injury, if you manipulate the C-spine or any dorsal spine, it will cause more hurt. The patient will end up in like a weakness of all the four limbs, and the patient will be bedridden. That's how it is important to take care of the spine. And after proper assessment, if you find any bleeding point anywhere on the body, check for bleeding point and try to stop the bleeding by applying direct pressure. If you are not able to get the bleeding, then you need to use the tourniquet so that the bleeding will be stopped. And if it is any severe trauma, severe fractures, bone open fractures are there, we need to use the splint. Whatever the resources are available, use as splint so that you have to immobilize above joint and below joint of the fracture. That will decrease further damage, and patient will feel comfortable also. Then we have to mobilize to the nearest hospital. Few patients, even though major accident like a severe velocity injury also, some patients will be on appearance will be looking good, but along with the other passengers, there is a high chance of like death will also happen. So the basic evaluation for that patient is needed. Why? Because most of the time we may miss the internal injuries. Overall, my advice to the community level people is to identify the injury severity and do the first aid, and at the center you need to take help. Knowing the first aid in giving the treatment or like first aid to the injured person is prime important. They can if you do few first aid things, there is a high chance of like saving the life and at the same time improving the quality of life. Like example, we can say example, if a limb injury like a limb cut happened like near total amputation or like severe crush injury, if you mobilize the patient as early as possible, identify and mobilize the patient to hospital, they can repair it, and the quality of the life will be of that person will be great. And in severe traumatic brain injury, we'll call it as internal bleeding severe. If you identify and if you go for help and call for help and mobilizing the same patient to the hospital, and if need of surgery, they will do the surgery, and in that point of time, it will be life-saving. So doing the first aid and going for the help and mobilizing the patient to the nearest hospital is very much needed in related to the road traffic accidents.
Thank you so much, sir. This brings much awareness of the community towards the road traffic accidents, right from responding to the traffic accidents, from mobilizing the patients, and then the first aid measures which you said. This brings much life saving and improve of quality life.
Thank you.